And now we'd like to cut to the chase and introduce our very first speaker, Mr. Marcelo Espiritu. If I can read your bio here, because you've got a lot of great stuff on here. Marcelo Espiritu is the Medicare HighCAP counselor, HighCAP product analysis, SourceWise community resource specialist. He received state certification for Medicare HighCAP counseling back in 2010. And since then, he has been an advocate for the elderly and individuals with disabilities who struggle with the complexity of Medicare, the myriad options, and the decisions they face. He's involved in training new HighCAP volunteers and supports their existing certified volunteer counselors, and he conducts community outreach and develops informational materials for Santa Clara County Medicare beneficiaries. He is an integral part, a graduate, of the integral program of St. Mary's College of California. Please, let's welcome Marcelo Espiritu. Thank you.
Thank you.
Yes.
Hi, thank you everybody. It's a pleasure being here today. I was here a couple years ago, but my connection to ESRD, actually my father-in-law is a transplant recipient back in 2000. And he's still going strong. So today I'll be talking about Medicare, ESRD, and before I get into that, I'd like to tell you about our services at SourceWise. SourceWise is the area agency on aging in Santa Clara County. Our mission is to provide expertise, education, quality support services to Santa Clara County seniors, their families, and caregivers. And we offer a lot of direct services. If you were to call us, you'd reach our information and awareness department, where we could connect you to resources throughout the county. We also have a care management group. This is for people who have Medi-Cal, and we would connect them with a care provider, develop a plan of care, and help them implement that. We also have a senior employment program for people over 55, and then a Meals on Wheels program. So there are many Meals on Wheels programs. Ours are the frozen meals for people who are homebound and can't provide meals for themselves. And as Karen mentioned, I'm with the Health Insurance Counseling and Advocacy Program, otherwise known as HighCAP. So HighCAP is part of a national program called the State Health Insurance Assistance Program. And our goal is, we are the local source of help for people with Medicare. You can call the 1-800-Medicare number and reach a call center, but if you want a face-to-face advocate, we're the program for you. So we work through a network of volunteers who are state registered with the Department of Aging, and we train them and place them at different senior centers or libraries or health centers, even here at Palo Alto Medical Foundation, to sit with folks and help them understand their Medicare options. This is our phone number. If you want to make an appointment, our services are free to residents of Santa Clara County. There are probably some San Mateo folks here too, and this is their number. We also have, this is the line in case you live outside of either of these counties. So today I'll give you an overview of Medicare. In particular, the two ways a person can receive Medicare. There's a fee-for-service system, and then there's also a capitated system, or the HMO managed type Medicare that one can have. We'll look at some of the covered benefits, the premiums, enrollment in A and B, some of the Medicare options, sort of revisiting these two paths that a person can take. We'll look at what it costs to use Medicare, and then some other programs. By all means, not all of the programs that can work with Medicare and help alleviate some of the costs of Medicare. Okay, so Medicare, first of all, is the Social Security Act, signed in 1965. It's our federal health program for people, for different groups of people. As you know, probably 65 years or older. Those under age 65 with certain disabilities can have Medicare. And then, of course, at any age, if you have End Stage Renal Disease. And these groups, they still have to meet certain qualifications. You have to have certain or have earned a certain number of Social Security credits or work history under your belt to then qualify. ESRD, permanent kidney failure. So if you require regular dialysis or a kidney transplant and have a GFR between 15 to 0, then you may be eligible for Medicare, Medicare ESRD. So if those two conditions exist, you have Medicare, but Medicare will end 1 year after you no longer need dialysis, or 3 years after a successful kidney transplant. And of course, after a kidney transplant, you still have a lot of costs involved. So it's important to know that Medicare is not permanent in that instance. The parts of Medicare. So in 1965, both Part A and B were signed into law. Part A is described as hospital insurance. It covers a person as an inpatient in the hospital and other areas. Part B, generally medical insurance, outpatient services. So we'll look at a little bit more at that. Part C of Medicare was introduced when managed care started becoming more popular. So Part C describes a private way to receive your Medicare benefits, typically through an HMO. Okay. Part D started in 2006, so Medicare didn't cover drugs before, except Medicare does cover drugs through Part B, but outpatient prescription medications were covered in 2006 under the Part D program. Okay. So this is a slide just showing you the different delivery systems, the benefits and then the delivery. So just introducing a term, original Medicare. Original Medicare, in the insurance world, we're talking about having Part A and Part B. So A includes these services inpatient, when you're admitted to the hospital, not sitting in the hallway in the ER, actually admitted. Skilled nursing care, home health care, and hospice care. Part B covers a whole host of other things: outpatient care, doctor services, preventive services. It also covers home health care. If your Part A home health care is exhausted, you can still get it under Part B. And different diagnostic tests and therapies are covered under Part B, and DME equipment. So there are costs involved with having just A and B. There are deductibles in Part A. There's a 20% co-insurance in Part B. So in the 70s, an insurance market popped up called Medi-Cal. So there are other insurances that can work and cover these out-of-pocket costs. Medigap's are known as Medicare supplement plans, and they cover the out-of-pocket costs of A and B. If one chooses to stay here on the Medicare fee-for-service side, you can also pick up a drug plan, like I mentioned earlier. So fee-for-service, a person can have these types of plans, and where can they go? They can go to any doctor, facility in the nation that's enrolled in the Medicare program. This is not an HMO style of receiving Medicare benefits. You can go where you want. You don't need a referral from a PCP, although those help to get access. But that is this type of delivery system. On the other hand, we have what are called Medicare Advantage Part C plans, and this is a capitated system. So you still have to have both A and B if you want to further enroll into a Medicare Advantage plan. So these are typically HMOs. So for example, Kaiser is probably the biggest example. You've maybe heard of CareMore, United Healthcare. They have HMOs and they contract with different provider groups and hospitals, and you have to stay within that network if you want your services. However, if you have End Stage Renal Disease, you are not allowed to be in one of these. They won't take you. There's a small exception. If you say, for example, we're working and we're covered by a company that also offers a Medicare Advantage plan, then you can move into it. There's some changes coming in 2021. These Medicare Advantage plans will now be taking people with end-stage renal disease. So that's quite a big shift. These Medicare Advantage plans have co-pays and deductibles as well. So those you can't get around. Unlike in fee-for-service Medicare, a Medigap could potentially cover all of your out-of-pocket costs. In Santa Clara County, in any urban area, you'll find so many different plans. So we have 20 plus plans. In Santa Cruz County, I think they might have 1 or 2. So those are the 2 paths one can take in Medicare. Drug coverage is included in Part C. So what does ESRD Medicare cover? So specifically, everything that A and B covers: dialysis services, home self-dialysis, training, equipment and supplies, transplant, transportation, preparation, coverage, lab tests, and so forth. Also, it'll cover the full cost of donor care. Covers immunosuppressive drugs under the Part B benefit, therapy, medical nutrition therapy, hepatitis B shots, and education sessions. And Medicare doesn't really cover transportation, but if there is an order from the doctor and it's medically necessary and other circumstances, then you can get coverage to dialysis. Okay. What's not covered by Medicare? So this is important to note just in preparation for these situations. Medicare doesn't cover people in the nursing home beyond 100 days. It doesn't cover routine services like routine dental, routine vision, cosmetic surgery, acupuncture, and so forth. Hearing aids as well. Medicare, neither A or B cover hearing aids, which can be quite an expense. And so you can also check Medicare to see what else is not covered. Medicare doesn't cover paid dialysis aids, lost wages, housing during treatment, blood for home dialysis, non-treatment related medications, and again, all other things that Medicare doesn't cover. So I'm going to move into how much it costs. The premiums of Medicare in 2018. For those with end-stage renal disease or Medicare due to a disability, it's free. Social Security is checked, you get it, so it's Part A is free, fully subsidized. That's the same for people age 65 who've worked 10 years and paid taxes, FICA taxes. There are folks who have to pay for Part A. They haven't established credit if they're over 65. Then they can pay as much as $422 per month. Part B, on the other hand, everybody pays a premium for. It starts this year at $134 per month, and it's on a sliding scale. It's based on what's called modified adjusted gross income, which in your handouts you'll have it here, but it's line 37 and 8B of IRS 1040. So here's how much it costs. So if you're making individually filing $85,000 or less, $134, and then it goes up from here. There's going to be a new bracket for those who earn over $500,000. They'll pay a little more starting in 2019. Now the reason this is important is because if you have ESRD and you have work coverage, the question is, should I get Medicare? Should I get on Medicare and pay the premium or not? Is it worth it? So one way to think about it is, and we'll get into it later, but is $134 going to be less than all of the co-pays that my employer plan will be? So in most cases, it's probably yes, and it may be worth getting Medicare Part B. Okay. So the eligibility, when could Medicare start for someone with ESRD? And I think probably some of you have already been through this, so I'm sorry for reminding you of this transition process. But it can start as early as the first month of dialysis if you go through training to have home dialysis. If not, then it's the 4th month of dialysis, and there's a 3-month waiting period. It can start the month of the kidney transplant, and if you're admitted, it can be the month you're admitted if it's performed within the next 2 months. Also, 2 months before the transplant if the transplant's delayed 2 months after admission. So that is eligibility. Again, though, you're not required to enroll in Medicare, but it may be worth it. So for those who have an employer group health plan, there is what's called a 30-month coordination period, where the employer plan pays primary, Medicare pays secondary. And after 30 months, then Medicare picks up the first bill and the plan picks up the rest. Now, just a warning, you can enroll any time in both Part A and B during this 30-month coordination period. But the warning is don't take just Part A and defer Part B, because you risk a gap in coverage. If you don't take Part B, you can't enroll until what's called the general enrollment period, which is January through March, and then it doesn't start until July. And so, I've had some people caught in that situation without coverage, and it's really not too good. Furthermore, by delaying Part B, there could be a penalty, a permanent penalty of 10% on top of the $134 that a person pays. So you'll want to, either don't enroll in both or enroll in both at the same time. If you enroll in both A and B, it will start retroactively 12 months. So you don't have to worry about getting coverage if you're a little late. The enrollment is handled by Social Security Administration, so they're the experts. There's so many details and situations when it comes to Medicare ESRD, so they're the experts. When it comes to the other parts of Medicare, you either go through the insurance company itself or through Medicare.gov or 1-800-Medicare. Those are the two groups, or the groups that handle that. When it comes to supplement plans, it's contacting the insurance companies. So once a person's enrolled in A and B, again, these are the two options. I have these X's because, again, with ESRD, you can't get into a Medicare HMO. Furthermore, these Medigap supplement plans are not available to people under 65 with ESRD. There are 23 states that don't require insurance companies to sell Medigap plans to people with ESRD under 65. But once you hit 65, then you can purchase one of these Medigap plans. So let's look at this first option, original Medicare. So you have both A and B, and you can go to any provider in the country that takes Medicare. But again, there are costs here, and there's no cap on these costs. Okay. For example, the hospital deductible is probably one of the biggest ones. It's $1,340, and that covers a person for the first 60 days. Whether you're in there for 1 day or 60 days, that's what you pay. Beyond that, it's $355 per day, and then from days 91 to 150, $670 per day. So these can add up quite quickly. Another one is skilled nursing facility costs. Those add up. First 20 is covered by Medicare, but then I think it's $165 per day after that. Part B, on the other hand, there's what's called a yearly deductible of $183. So that's paid out of pocket the first of the year. Beyond that, Medicare will pay 80% of the services that you have. And you're responsible then for 20% of what Medicare says it costs. So although maybe you'll see a huge bill that the provider issues, Medicare says what the cost is, and you pay 20% of that in these different areas here. Okay. So again, that's why Medigap plans were created, to help cover those costs. What are they? They're sold by private insurance companies, but they can use health screening and deny people coverage. They pay the gaps in Medicare that I mentioned, and there are 10 standard plans, A, B, C, D, F, G, K, L, M, and N. F is the most comprehensive plan. So a person with regular Medicare, with a Medigap Plan F, there are no copays, deductibles, or anything. That's probably the best you can get, unless you have other coverage through, say, the military or through a retiree plan, and so forth. But again, you have to be enrolled in A and B to get this. ESRD Medicare, though, again, won't be sold to someone under 65. I hope that changes. Thank you. The timing is important. There are rights that folks have. So when you turn 65, if you have ESRD, that's the very important birthday, because a lot of your costs can go down significantly by getting into a Medigap plan. If you lose some type of coverage, like an employer plan or COBRA plan, it triggers, for those over 65, a right to get a Medigap, no questions asked. And if you do have a Medigap plan, it's important to know that the premiums do go up each year. And one way to rein those in is to understand your rights. So in California, we have what's called a birthday rule, where you can switch to a company 30 days after your birthday, and they cannot ask you any questions, and you're guaranteed that plan and that rate. So I had a client who was, I think she was living in the Villages. She was paying almost $1,000 a month for a Medigap plan because she just let it ride year after year. Well, using this birthday rule, after some conversations, we were able to get her plan down to, I think it was about $260. So this is an important right to remember. Outpatient drug coverage. So if you have A or B or both, you can get drug coverage. It's provided through a host of different companies. I think we have over 20 in Santa Clara County, or Northern California. What we call PDPs, these work with original Medicare HMOs, they have drug plans too, and then some employers have drug coverage also. I don't know if has anyone heard of the donut hole before. So if the donut hole was started in 2006, it meant that you had to pay 100% of the cost of your medication after a certain amount of spending in that year. It's been closing, which means the percentage you owe has been decreasing. So it will close 1 year early. Next year, you'll be responsible for 25% of the cost of the drug. I think this year I think it's 40% or for generics or brands. But altogether, next year it'll be simple, 25%. Plans can offer better pricing than that if they want to. So there is also an adjustment depending on income for Part D. So you have a Part D plan, you pay the premium, but then there's also some money collected depending on your income as well. So Medicare Advantage plans, again, starting in 21, it will be available to folks. Still, in order to enroll, you have to live in the county's, in the plan service area. And you still have to have A and B. There's still premiums. But the advantage of these Advantage plans is that with the Affordable Care Act, there are now maximum out-of-pocket limits. So that means that you sort of know the limit of what you're going to pay in terms of co-pays and deductibles in these plans. So $6,500, I think it's $6,700 this year is the cap. Plans can do better than that if they want to, but at least you know that's the cap for a year. Okay. So, does anyone here have a drug plan, a Medicare drug plan already? Okay, so this is an important time of the year, the annual enrollment period, which is October 15th through December 7th. This is the time to reevaluate your drug plans because last year we saw clients with the same list of drugs, same plan, didn't do anything, but their prices went up like hundreds, sometimes thousands of dollars. So it's important to reevaluate your drug plan each year. And that's something that we at HighCAP can help people do. We do that all the time. Also, if you happen to have a Medicare HMO, this is a time you can get out of it. You can disenroll, but you would go back to having original Medicare, that path on the right. But we warn people, since the out-of-pocket costs can go up quite quickly, make sure you have some other kind of supplement in place if possible before dropping an HMO plan. Okay. So there are other programs that help folks, not just Medigap plans, but there are important Medi-Cal plans for people with low income and resources. So the most popular one that a lot of our clients fall into is what's called the Aged and Disabled Federal Poverty Level Program. And these are the eligibility amounts. So a single person making $12.42 per month with assets and resources less than $2,000 is eligible for Medi-Cal. And when a person receives Medi-Cal, then the Part B premium is paid by the state, and the person is protected against all of the different copays of Medicare. There's another program that a lot of folks don't know about in Medi-Cal. It's called the 250% Working Disabled Program. So if a person is deemed to have a disability, then they can actually earn a bit more income and qualify for Medi-Cal. So they could earn $2,529 per month as a single person, or $3,429 as a couple. They still have resources that need to be less than $2,000. But what's good about this program is, someone with who's been deemed to have a disability can work, and work is sort of there's no minimum amount to earn, and there's no minimum time a person has to work. So even in their literature, Medi-Cal says if you pick up cans and get money for that, that could be considered work. Or if you're being paid to read to somebody, that could be considered work. So if your income, and plus the wages that you earn are not counted fully, just half the wages are counted in this calculation. So a person can get Medi-Cal, save a lot of money, and actually save up some money because the money they earn can be put into a separate account, and then a lot of the Medicare costs are covered. So this is a really good program for folks. For those couples where one person requires what's called nursing home level of care, their incomes can be as high as $3,090. And assets higher than up to $123,000. So that's another way to get Medi-Cal that a lot of people don't know about. Okay. Medi-Cal has other programs called Medicare Savings Programs that help, if you have lower income, pay the Part B premium or Part A premiums. There's also a program called Extra Help for Part D. So these are the different eligibility amounts. So income's less than $1,508 for an individual, and for a couple, $1,203. So it really lowers the cost of medications for folks. Sometimes to $1.25 for generics and $3.80 for brand, but this is sort of the mid-range. I put a slide in here about the insurance marketplace because this has become an option for folks. It's an option as long as you don't enroll in Medicare Part A and B. These are private plans where you can actually get work or tax credits. So what might normally cost a person $800–900, if their income's low enough, it could be closer to under $100. But you only get those tax credits if you don't enroll in A and B. So it makes deciding between this or Medicare a little more real. And it's a difficult decision to make. If you're considering it, really make sure you understand what you're getting into, what the costs are, and what you give up if you don't join Medicare and take one of these plans instead. Okay. So I think my time's coming up, but I just want to impress upon people that there's a lot of fraud and abuse in Medicare. So when you're in it, make sure you check all of your statements. If something doesn't look right, like a service that you knew you never had, then you can let us know. We'll move it up. But billions are lost every year to fraud and abuse in Medicare, and we've been paying for it, into it our whole lives. So please, help us to control fraud and abuse in Medicare. Here are some resources. There's a book out or a little brochure from CMS, Medicare Coverage of Dialysis Patients. So here's the link. I put in the Medicare Administrative Contractor. So if you're kind of a wonk and want to know what's covered or not, this is the place to go. Noridian Medicare is our MAC contractor. So you can go to their website, type in ESRD, and you'll see all the criteria that's necessary for coverage, etc. Because no one will tell you what's covered or not. It's so difficult to find something out like that. Also, if you're looking for rates for Medigap plans, the Department of Insurance receives those rates from insurance plans. And so this is the link to get to that. So with that, thank you very much for your attention, and I look forward to your questions.
Thank you, Marcelo.
Okay, thank you.
Thank you so much. Does anyone happen to have any questions for Marcelo? I'm sure there's a few out there.
I'm a transplant recipient and 9 months, as of 9 months ago, and am I considered an ESRD patient?
Yes.
I am?
Medicare, yes. You have a red, white, and blue Medicare card?
I just got one.
Yeah. Yeah.
But
So,
it doesn't have ESRD on it.
oh no, it doesn't say anything on there anymore. But yes, you're considered Medicare due to End Stage Renal Disease. Yes. Yes.
Is that indefinite? I'm sorry.
Since you had a transplant, and if it's successful for 3 years, then Medicare will end at that point. Yeah. Okay.
Since the person has a transplant, you were talking about in 30 months it'll, dissipate. I mean, you'll lose the Medicare.
3 years, yeah.
3 years. And what it is that it behooves a person to look at the list of Blue Book in terms of diagnoses. And when you look at it, you should work with the physician in terms of the coding. And if you have another diagnosis when the 3 years come up, prior to that, what you should do right now, if you have a diagnosis, is it qualified to have Social Security disability?
Mm-hmm.
Then what it is that you can have that on your record, and then when the 3 years come up, you're going to continue on with your Medicare.
Yeah, thank you for bringing that up.
When you have Medicare, when you're 65 Medicare, do you need an evaluation by the insurance company for your health, or after that you need to be evaluated? It's the first time 65 you need to be evaluated.
Did you say you already have it?
No,
Or
I don't.
when you turn 65?
When you turn 65.
Right. So when you turn 65, you'll have what's called an open enrollment for Medigap. And when you submit your application, you won't be asked to fill out the medical history section. It's prohibited for them to ask you. Yeah. And you'll be guaranteed the coverage.
You don't need an evaluation.
No. Yeah.
Another question.
Yes.
Hi. Okay, so my daughter is 24. She's had her transplant for 21 years, but she's now, it's failing, so she's gonna go back. She's actually back on the waiting list.
Okay.
She falls into this weird area because she doesn't really have enough work credits. So she is covered under her dad's policy until she's 26, but should I still have her apply for Medicare since she's end stage renal now, or wait? I mean,
Yeah.
we're in a strange situation, because when I go online and look, it says you have to have enough work credits, but she doesn't.
How old did you say she is?
She's gonna be 24,
24.
and this will be her second transplant.
Okay. I'll have to look into that, but Social Security is probably, I've been, preparing for this and looking through all our documents, but there's so many details about situations like this. Let's talk later, but, I'll definitely ask somebody at Social Security, but they would be the first group to go to parse that out.
Yeah,
Yeah,
okay.
okay. Sorry I can't answer your question now, but yeah.
I'm just curious to know if for the dialysis treatment, if you're traveling abroad, do you know if Medicare provides coverage for that?
Medicare doesn't cover, not abroad, no. Yeah.
Do you know of any resources available?
No, I'll have to look into that. I don't know if anyone has any insight into traveling abroad with dialysis. But I can check.
How do you qualify with Social Security for disability? Can you be under 65 to qualify? What's the criteria?
Right. So Social Security disability can be had, under 65, under your full retirement age. They go through a process of establishing whether you can no longer have substantial gainful employment. So the doctors involved and the type of work you do comes into play. So when someone is granted Social Security disability insurance, there's a waiting period. I think it's like 5 months, and then you start receiving Social Security disability insurance payments. And it's not until your 25th check that you're eligible for Medicare. So there's sort of a 29-month waiting period before you can actually qualify for Medicare under disability.
I was 59 years old when I was diagnosed with End Stage Renal Disease, and I went right on Medicare.
Yeah,
It
so,
was just like boom, boom, I mean,
yeah,
as soon as they advised me to get on it, when I was leaving the hospital.
Yeah.
They said, yeah, you get on Medicare.
right. So there are different ways people get on Medicare. ESRD, right, you get on it right away.
And Social Security disability I started drawing that too at the same time.
Yeah, you could have started drawing that. There's a process for that. I think with certain medical illnesses, there's no waiting period to start receiving Social Security disability payments. But as far as qualifying for Medicare due to disability, that wouldn't have happened for you until 24 months, your 24th check. And then you would have kind of both ESRD Medicare and Medicare due to disability. You can actually have both. So when your successful transplant happened, then you would sort of have Medicare, as to your point, have Medicare due to disability and still have coverage, which happens to quite a few folks.
I think that's it.
Okay. We got one more, but
Oh,
do you want
in the interest of time, if you wouldn't mind, and we do appreciate your questions, could you write that down and meet with Marcelo afterwards? Would that be a
Sure.
possibility? Okay, thank you
Okay.
so much.
to? All right.
Marcelo, before you leave, we have a nice gift for you, something to remember us by, because we will certainly remember you.
Oh, well,
Little
thank
gift
you.
here, and it's a sunny day, so I think you could put this to good use.
All right.
Thank you so much.
Thank you.
Let's give a hand for Marcelo. It's good. Thank you so much.